yede enchia ede bro baby bia wo ebia na wo hwe Bok TV ewie megidi yese nyame adom enenso so ode ache yen sede ye wo Ghana mantimu na ye koyenim ye ma chi koyenim ye no megidi yese ene nyame ede ache ya wasan aye yadom na ye de yaba Bok TV yaba studio enti na chese ye nu eba bedi juma eson na ebeboa ye nyina na yetimi akoso anasa yakoyenim yakoso akoyenim ewo abrabom iye talk show said de bia ya ye ka kire no umpomuden so ho ehia ye bi enye aware ne relationship ne nko a na emom ye mpomuden ya setena mu no ya na eno so ehia ye said de be ya unya apomotimi ayeye e de amawo enti enne nyame adom yenya doctor yene ni di dwumasono ewo Bok TV ha say enne nyame adom ofri University of Ghana abeka ye ho enti jebre na etnase na sede ya hye obo say wapomoden hu hia ye no yesan emetwetwe ho nkomo na ebia de ebeka ho asem yi wo haw ni bi mu ana woni mo bi a wo sa problem no bi na waka kire no na wono so watie bi na etimi aboa medende mama Emilia ene nyame adom me na medi dwumadie iye talk show medi enimu ana se maje egwa e wo studio ha mato nsa frɛ doctor ye number egu screen enimu a enkoma ye betwetwe se opese woni bisa doctor ho bibia ana woni doctor kasa ye number no egu screen no enim eye 054 0356306 eno no WhatsApp number no eno no enti bibia opese send ba bebisa nkoma ye betwetwe eho asem bia no doctor beyiwa no wo ha sei obeyiwa no saa enso ena ye program a ye no ye streaming live ewo Bok TV GH anase EA talk show ni nyina ho no ukọ a ubetimi ahwe bi na onso odo comments afa ho na etimi aboa yesrew eni diemu na wa hye nso amayen na obi susu etimi enya bi ahwe na etimi aboa saa nso ena ye streaming live ewo TikTok eno nso eye EA talk show saa no ubenya na eno nso odo comments afa ho yebekọ na eno nso ye read you comments na wo dey fa wo dey say your question na opese wo di bisa doctor say eye suggestion bi eno nso wo dey fa wo ba ye be ready na doctor etimi ama ho emuaye ene nyame adom menya doctor Samuel Enina J a owo University of Ghana Legon Medical Center wow UGMC ene nyame adom oni yen eba be kasa afa yare asthma nipa ne bebre go through omu a omu hu nia omunye nkola especially nkola num de ne de ba na adwokra na chese awofo no na chese aye asemalanko enti ene nyame adom yato nsa frɛ Dr. Samuel Enina J a oba be kyerɛkyerɛ ede akyerɛ yen sɛde yare ne su ene sɛde esi etie ene kwan a efa so eba enti ene nyame adom meto nsa frɛ doctor bacho akwaba Dr. Brantie nyame nsa bebre se ebribia iye talk show ye to yen nsa frɛ wa oje bre na obeka yen ho e wo studio doctor na me bisa se you can qualification and I can credentials no okay. So general doctor
general practitioner medical officer
medical officer until what you man say
see share outpatient department and inpatient department so almost every condition be the Baba clinic
be mutimi solve oh okay and then say what you man do so pa wow nyame inshallah bebre se wa ma ho kwan na obua Ghana eman nyame inshallah ene yeyi to se be kyerɛkyerɛ yen asthma yeti asthma yare nkwala wo bi empanimfo wo bi emrantie bibia timi nya bi said ye yare no de enti ye frɛ o say ne the church ye asthma.
Okay.
Enti mpacho doctor e de ne asthma.
Okay. It's first of all, meda wasi biom suma ton sa friend ye bedi nkomo for asthma ho.
Amen.
Ye kan asthma yare bia baby a ye home fa no emutumi si na ma ye home no ayedin.
Oh.
Nti baby a nipa home fa no broni frɛ no airway. Ne ye inframa na we ne ye kwan nti inframa kwan no emutumi si na
ewo ye minimum ana ye hunimu ana free ye hefa na ye no na hye
sa airway no with the diagram be to
but ya na mo hwa ma ye why
so ma ye diagram
doctor the diagram be ma mo nti mo hwe ma ye aha okay
nti wo hwe diagram wo ya wo hwe se nipa no wa home bibi akonmu eye blue air cut down. That's the airway. The free
enufra bonten na ekoni.
Arrow blue na ekoni mu no. Eno ne mframa na wa home no. Na baby a air fa no, eno ne airway no.
Oh, okay.
In asthma no. O share diagram na lower part no, o me zoom in of baby a air no fa no. Ba kuluki very big. Chese mframa fimu a embre kra. Na other one no ye obi a wonya asthma. Emu ato.
Wow.
Nti mframa afemu a eyedin.
Wow.
Aha, nti obi won se nipa ko na ohome a na obre.
Nti de obinya asthma na fanse say na.
Yes.
Ni airway no kwan na ye
aye. Na normal one so na e won nchen. Normal one kwan ni mu so pa.
Proper one no
ohome a free. Okay. But other one here obi a wonya asthma. Ohome a kwan ni mu so a nti mframa no ntumi mfem can say is genetic. That's obi mami anane papa na nwe bi wo bi a likely so no so ebe wo bi. But in premping no mu bisa cause ya na ebi mo patch say the triggers of asthma. Just say the to me trigger asthma no mo nya mo symptoms no. Eno de edoso ebi ne viral infections bit is a cold. So when you cold na betumi a trigger. Ebi nso ne smoking omo smoke and smoke cramp we wiem no ebi nso ne dust dust no ye dust we wiem and say ohwe omo sort wheat ne soya so omo ye grain hu juma cramp dust no be trigger
omo ye adwuma wo ti say machine omo yi rice hu na say
yes omo yi rice and omo ye adwuma even sawmill
no okay
timber that's ne free hono and also strong scents and perfumes since betumi a trigger asthma symptoms no
okay
and after for you be a friend no allergies and no ye niama normally no me ne wo no anke ehome ana say your body no gets into contact and harmful to us but omo react to it no if they get into contact with it they react strongly ebi ne say ebi ohon ma ne home kron to me home ebi mi onimu to me so ebi mo ano to me akese that's another common trigger of asthma. Yes.
Oh na say niema atimi de trigger the cause ne de mu nse da nim
cause ne de causes ne different types of asthma ne bia one cause and most of the causes
doctor na church mu bie o che be mi enu mi ensem bi kura e be fa
nti wo something we call atopic asthma and na running through the family no nti ube on say most of the family members and so were the same asthma no
obi wa ne maami e wo bi
ne maami wo bi ana ne
papa wo bi nti e wo na eno no eba tambe ye wa wo baby na say wo nyi ko na o develop ba
mostly no some baby no fresher on tie and show symptoms no ebi or crampa after 2 years and so best start here show symptoms no it's rare said below 2 years no on be show symptoms ebi mkra on mo be nye dromu teenage years
and sana
ma show symptoms no
okay na je senye wo fiti ya na wanya
take it time
take it time okay na wo kasa no ka say bibi ti say the frama bia spray bia strong scent bia dust nti dust no na ye beka say yen ya what dust mu to Africans ne na etanya saa de na na se abrofo nyina atimi nya bi.
See, I know your trigger. That's obia or asthma no de dano. So you're exposed to that star. Bet me a trigger almost symptoms no.
Okay.
Obia only be no. That's no and shut down cause to them.
Okay.
It's more asthma no de dano. When they are exposed to smoke and now dust na symptoms ne be ne say untumi how many are then ebe trigger asthma no. That is it.
Oh, okay. Na je say dust no we obi a na se obi e bede wahu ti say me fan say me papa no obi ba me nibi but me nyi ba na bede mehu say menya bi.
Okay, I don't know. Most of the times no said the oka no enye obi a no benye bi even if Sane mami and ani papa will be
okay.
So some people will be lucky. They will never get it. Ebim so hono ma omo mami ni papa will be ono so ebenye bi no usually known to me and predict sa
okay.
But the diagnosis no so yeah a different thing altogether. They say omo mo bi no usually no omo to me home and as omo bowa mostly no bowa at night. And maybe on because some chest eye tight and na omu use be a friend inhaler omu homia sa symptoms dey
me question no nti me bisa wo eno ho asem nti so what are the common misconception people have about asthma? I think say o kan ho asthma no
nti one of the major misconceptions is ebum dwen say esane Inti because running through families no say bia obi papa obi ne maami nso obi ne ban so obi inti ye bi mo adwen say so mo ben omo a omo so ebenye bi ben tisa enye infectious.
Oh, okay. Ensai.
Yes.
Na je say obi a obetimi na anom cap obetimi ne no atna oh unya bi
other misconception nso say omuntu mi endi agro. So mususu asana men kwa nkodi agro nyesa but from studies no omo a ye control omo asthma ni ye no ombetumi di agro to say
oh okay
ye hia ne say omo da the right in drone so no more fa ombetumi di agro to so bia. The third one also say ebi mo feel say omunya ebeko completely. The truth is that omunya symptoms no e reduce but enko completely. It's in pain no yeah ebi mo honma omunya no mo jai omundro no fa ni ade e risky and dangerous. That's one major misconception. Once oma diagnosed with asthma no, you always have to have your medications. Symptoms no nya ebe brase but still have your medications with you.
No now okay medication, you have your medication no. Na sa asthma no eba obi so ana wo obi so a ye de ne tu no so maneche. And I say, o setem bia wo fa duro ti say de obi a emeka say obi owo ti say hypertension no na se for no.
Okay, inti a chronic condition meaning ye cure. No, inti ye di omo tundro so long term. Okay, but enyo obi an obe fedro every single day. Ebi mo fedro no as and when they need it. Ebi mo so fa no every single day. Ni no depending on how severe. It's any types no said they are can how severe or symptoms net here and types. Ebi mo dia no so mo work it out in kwa no munya. Tia no omo fan only when they have to work out. Ebi mo so dia no when they are exposed to any form of allergen they get it, so they are more likely to take it every single day.
Nti obi e asthma to say oye younger ni maame ana ni maame beka say nkodi agro nkoye gidigidi na so oye panyi obi ye panyi no wo bia obetimi aye hard work obetimi aye adwumaden ana obetimi aye bibi opese oye
obetimi aye bibi opese oye
sa
once
na je say yare na enye hu ana
so fa undro no dia enye hu Because so far now, we reduce frequency of symptoms, no, and even how long when your symptoms now be lasting. The so far any form of a jumadin, exercise, a bim cry to near dear, hanty. Mostly we have people omutu emika professionally.
And so also asthma.
Yes. Into no.
Just take your medication. Nkolana. Ni mambe kofi nkodi agro na wasma na amano. Na say wo ha kolana na say.
Inti the inti say most of them no either some fe dra na some fe droni. Because se wo di agra ohome ntem. Sa wo bra na ohome ntem. Na ohome fa wenum. Whether ni ye colder, who breathing in dry, cold air, which can also trigger the asthma.
Wow.
Into one of the cautions I am more money say, number one, ube found drona control asthma ni. Number two, whether ni ye colder, ube to me ha should be to face mask. And ube try say on home fa wenum, ube breathe it through your nose, which is the normal way of breathing for obi a winyi biano.
Okay.
Yes, you less likely get an attack. Even if uye jumadin na udi agro gidi crampa emba
uye jumadin kra emba. Oh. Okay. Ewie de wo hwe e Talkshow ene Dr. Samuel Enina J efri UGMC abeka yen ho e wo studio ha se ya ene o cheche asthma ekwan a efaso eba ene kwan a ebefa so aboye ho ban anase yetimi asi ano enti baby awo bia o TV edabok TV no invite obi na kachire unua say onhwe ene programa ye de nambok TV so ede eba na ebeboa papa ye kasafa asthma ho bia watidin ebia unua bi wo ye onu kra ma amini ni bi nso akora no bia wanya bi ene doctor che ni nyina enti no invite no se onhwe ene ye Talkshow dwumadie na onfa ne comments anase onfa ne messages emfa ye number no eso ye number no egu screen no enim 0540356306 eno obetim de ne WhatsApp messages afa ho sa enso so eno obetimi ede afa ye Facebook no eso ede aba ye Facebook name no eye Bok TV GH anase EA Talkshow sa enso so ena ye wo TikTok enso so ode ne messages fa ho a ye be reading nyina on time enti no kache wadamfu bi se onhwe ene program no na ebeboa na ye kasa ede afa asthma ho ene doctor o chirechire yen ekwan a efaso ede ba ebi eye efri yawo mu ena bi susu free mframa ye home no emu enti ene doctor o chirechire yen ekwan a ebefaso na yabo ho ban. Doctor Antimi Pacho me ba me questions no esu bi.
Okay.
Yeah, what are the signs and symptoms of asthma?
Okay.
Pacho
Inti asthma no there are 4 major symptoms.
Okay.
Okay. Inti ebine say omutai bo apa. Ena wano yo mo bo no night time.
Eba anajo.
So mo bo wa. Obeka say from 6 o'clock e kon na ya me bo ne pa. That's night time. Ebi nso so beka say omo chest are tight. Chest or home ya and shed in so ye chest are tight. Obi nso beka say ontumi cramp on home ye. Ana ne home mu aye den. And as omo back clinic nso so ne say ye ti omo chest nso so a ye ti sounds bia. Your Thai friend wheezes.
Okay.
So that's one sign.
Okay.
These 4 things, we among more asthma, 90% of them are one of these 4 symptoms, which is the cough at night, chest tightness, homina omobreno, and I eat your chest and swat. Wheezes, the dinner or chest, so more asthma, we 90% or more one of these symptoms or sign.
Oh wow.
Yes, there are 4 major symptoms of
Doctor, anti sad ma we no. Aduane ya di timi de ba. Ya didie.
Okay. See, eno na efre bibi allergy no. See, aduane bi obi ho no ma me no ye di a ha me en kose hwe. Yen react to it.
Oh.
But omo asthma no. So react to sa particular aduane na ofa ebetumi a trigger asthma no.
Oh.
Ebi ni say bia we di pineapple, wo di anya ohwebo, obi di pineapple la ebi ho na home crampo to me esi.
Oh.
Tell your friend no allergy.
Allergy.
So it depends. And you say aduane na enye per se, but omo body na react to. Yes.
Oh. Hey, any asthma so na me feel say bia. Okay, na obi so say o home o ye spray se a ontimi ntenam. Eno so if asthma no ba ono ohun ne ho say o asthma. Enso obi spray ade bi ano eden wa hasisi a ontimi entna yeah. Eno so ka asthma ne ho.
Oh, they be eno ye normal. For us to say that for asthma na so back clinic near diagnose so your test I dey diagnose and the 4 symptoms no so ameka ye no so omo one or mostly omo one of them. But a ban bibi says strong scent and a smoke near there almost everyone. Etna baby smoke na said that's near too much obi abe complaining to some degree but omo asthma no ebe so severe that omuntumi home cramp yan fan from means omo so a anhwa na akoya asem.
Wow. Okay, me go me questions no eso. So how are asthma and allergy connected? They are connected.
I mean, like they are related.
They are related.
Se no na make no. Se microphobia or crampa omuni asthma, but omo react to in drobia and enuane bi ana niema bi. The same way omo asthma no. Say them can different types. The freba atopic asthma. Omo tie react to eniema normally nonka. Yen react to. The ability to say insuring in France flowers. Unse propro some powder be. And we say some women say komumua which me trigger symptoms no.
Wow.
So almost everybody with atopic asthma no. So omo humi ade a ene omo ho nje and omo di aduane bi a omo react to a which me trigger omo asthma. So it's related asthma and then we know allergies no they are related. Yes.
Okay, Doctor Ububo asthma no types no bi mudin wa say aboba kudin
atopic asthma.
Atopic asthma. And about ebi nso ye den.
Yeah, well, aspirin induced asthma.
Aspirin induced
aspirin trigger almost symptoms no.
There's omo ya allergy to aspirin.
Aspirin no.
Oh. Okay. And there hin biem.
Yeah, well, bibi say exercise induced asthma. And omo ye dwumaden said there now be sana. Na trigger asthma no.
Wakoye dwumaden kese a won te se bi okọ America oye sports bia.
Yes.
Eno no etimi trigger no.
Etimi trigger asthma no. But no normal finding out say most people munya no omo control omo asthma ni. That's number 1. Number 2, most athletes omo mu to America no omo mu swimming ni ade no. Omo tanya that kind of asthma no.
Nse se oye adwumaden oye adwuma obe home ntentem
obetumi aye but as a so fan indro no the controlling asthma ni so controlling here enter man those symptoms no but one controlling here ne so oye adwumaden ati se de meka no obenya symptoms no.
Okay, and now doctor there hin bim asthma ni types no there hin bim
three major types are it be a far less common. No. A very small proportion of the population but these 3 ones are the major ones are yetanya.
Okay.
Atopic asthma. Aspirin induced asthma, exercise induced asthma.
Is it common? Asthma, is it common?
Yes, asthma is.
Yeah, nti wo hwe Ghana population na muta record bi.
Yes.
Edoso.
It's quite common. And kanka omo musano. Children are more prone to asthma. Like yeah, juma clinic no. You try admitting kola more than in penny said them kind after the age of 2 no. Omo no, we tend to see them at the clinic. So but so to me who Dr. Yo Bowa na Jopa in Coladi omunta in case omu chest tight, but mainly no ya home na to me home na say one or bona na jono. No na ya omu tie completely.
Enti no sa na ye beka ne say nkola ne dose no na say ye nyine a na eso ti ana say
yes mostly no ye nyia symptoms no ebrase nti na bi modwen say omunyi free mu no ba omunyi free mu enko completely symptoms no na to me ebrase ben no bia na omunyi a ebrase but mostly no omunyi a ya ebrase yes
and so the nipa be say 50 eto a e beka say 40% de ekofom.
Yes, mostly omunya symptoms no ebebrase.
Okay, doctor no nti na ye hu ni say yare a ye hu na because
sure say no score.
And also
can hu nti na ebi mu hu ne say enye hu sa no.
Oh, ebeko. Ona na asthma ni wo bi so ne de ekoye. Eso so na hihye ho.
Eso na hihye ho no. Oh. I think that the other parts no so say ebi mo ho no ma omuni asthma. But then because BBC are going to me home need to know my branding or asthma. Oh. I think that's another part too that we have to look into. Because asthma no esa oba clinic near diagnosing. We have a way of diagnosing asthma. Because we be honum crampa or say or asthma so be ana oni asthma nti onyi ye na onya symptoms bi o me say ne de ekọ.
Ne de ne ko. Na bi ehye ho. Na wo ma me bi kra ti mi be de nani ti mi be hwe ade ye obey de
asthma.
I'm finding hospital. No. Oh, wow. Enti no doctor na sa 4 or 3 types ya wabubo sui. Ebe de na obi be hu se ne de no eye we bi. Ana we ni we de no eye we de eye we. I think so what they mention
yes, usually no the treatments near the same. So there is no need to be bit say exercise induced asthma saying they have a specified tester omoye and so no me to me use omundro and yes sir use na they will term it as doping just oma fendra enhance omo performance it's your specified test but I know you 2 details on friend EVH specified test yeah and so you to me the oma to indro so be to me afa.
Oh.
And yes, ko to mechanics omofa and say your blood test and see who's androna. They will term it as doping. Usually, no, we don't try and stratify them, but treatments are very similar. Once they have asthma, no, yeah, they're too similar in Droso.
Okay. We invite you for na. Omunfa messages no emfa ye number no so emfa emra na wonso so ene me bo me homodin bia say maybe sa doctor question na ma e bia o baby e wo asthma unua bi o papa bi doctor ya metan se mpanimfo no especially nkokrafo omuta wa asthma pa o ana unyi ana ekofo ma fe unyi ni wi ana asa peja ni mu ana
Mpenifo no so muntu me humi anema bebrebe tumi akose. Nti I would suggest that so be enyi ni so ntumi humi it comes to the clinic.
Okay.
Nya hwehwemu ye. Bi kra na heart symptoms. Yeah, other things so I refer back to COPD.
Okay.
And also a lung condition. Your heart
condition. And no one lungs no eno de nya bebia wo humi no airway no one.
The same place but the cause is very different.
Okay.
And more heart failure and so almost so home.
To me, okay.
TB crying in the lungs and the hearts and the cause issue.
Okay, because me tell say penny for na say omunyi kono 84 kono 74 84 ya me tell hu say omu ebi mu complain say asthma
maybe
enti now be hu ye wo baby free asase ba na ya point ya cho say una na asthma sika no
maybe
na say nye ya asthma obi wa ne health ne heart ana say ni breathe no na hu ba asem
the heart no na air failing and I said there are other lung conditions causes be cry there serious conditions I say obey ni mo ya me but otifie no so ye asthma asthma usually no say onya asthma da ne say onyi yedi 80 ansa na onya very unlikely say asthma
ya na ebibi fufuro
because asthma no usually no is before the age of 40. Most diagnoses are you're making before the age of 40 years.
Okay.
Until you diagnose you before 40. This when you are 40. This all start showing your symptoms. I say making sure saying you
be fufuro.
Yes.
And your asthma na.
And your asthma na. It's very likely saying yeah.
Doctor, na asthma okay, mami misa question we me wan me bisa ho asem. Does family history play a role in asthma?
Yes. And only genetics na make ho asem.
Okay.
Because said the American the main cause no yen to me fire answer insisu because the types are a lot. Types no do so but then one common thing your time who say so be papa na ne mama na ni nwe bi obi a ono nso so ebetumi enye bi de omo kan say yeah ne mama na ne papa na ni nwe bi obi a omo fresh sana omo nso omo airway no inframa kwan no sensitive inti say omo ye exposed to anything ebetumi a trigger na airway no emu a block na ma omo home no ayede ye won fresh bi wa ye hu saa till ebia after 2 years and now say when you create run teens and son wa sha say so enya symptoms no to be wa ye be won na hwe no ebim so de etumi sha say entem even before 2 years.
Is it my question is it a spiritual issue? a spiritual and say just bloodline physical whatever. It's not. It's
more of genetic because we shop in Crawford Bebre, and even to say there now be no. Ebi mo on ma omutumrika professionally.
Okay.
But then they also have asthma. See, it's quite common.
Oh.
It's quite common.
It's a spiritual thing.
Not likely.
Okay. Spiritual and the baby na just say no one abada.
No one abada.
Obi de no wajim.
Yes.
Oh, okay. Na just say spiritual ye genetic. Yetime de wo
to me passing it on to the child.
Say bia mama and papa wo bi no. Na ya wo baby no, how can we prevent that sickness from the baby?
Okay.
But then yes, ya born ho ban. And I say abone ho ban every say o menya bi. Eno no e basa doctor wo eduro bi injection bi a mo be wa abofra no and I say counseling bi a mo be mama da no say bi a o yare we ye bo ho ban free abofra no ho ama.
Okay, for genetic conditions no the cause no every genes no more so usually no there's no much drugs obetumi about counseling parts no they redo it.
Okay,
whether or asthma na say only sakola so a you try say be catch mama say o feeding the aduane a you know one by one sana or react to bibia we no wejai.
Oh, okay.
So that's one thing that helps. Also, you be counsel almost say because mama ne papa na ni nwe bi wo bi no. Omo hwe niye. Sana enema
because me kai say obi nyim na o continental ne nyina ibisa no. Forms no so e wo so.
Yes, I feel it.
O fie yare we wo ho. Yare we wo ho. Enti se bia in case se bia mama na akra wo bia.
Yes.
Advice am de mayen anase mo de be ma nipa ne say.
Yes.
E bia abofra ne ba hwe ye ni say de be ya o menye bi. Eno no
eboa because say ne mami will be and papa will be before the age of 2 years no it's difficult to diagnose asthma.
Okay.
Because nema bebre hon ma ese
asthma but enye bi.
Yeah, but enye bi. But say ne mami and papa will be before 2 years you can sometimes to some degree say that ebetumi asthma sakola ntumi homia.
Oh,
yes,
okay.
See, those are some of the counselings yeah, the more sakola to me homia fane hospital so di aduan bi ni so to me homia jai ma so was some environments bibia or the no far grass mun say to me homia and fane fa those are some of the counseling
Modema.
Yeah, the more.
Oh, okay. Na yesa mo boa ye wo sa kwan so.
Yes.
Oh, okay. Nyame insura mo. Ewia ide yes so send your messages na efa ebebisa doctor. Question na opese ubisa no. Edifa ene ye topic e dia to ha say asthma no bisa no asem because bia na wo de na opese ubisa no mentimi misa ma enti obetimi asende e dia fa ye number no eso WhatsApp number no eso 054 035 6306 054 035 6306 eno no ubetimi e do WhatsApp messages no e de afa ho e de aba saa enso so e na ubetimi akọ Facebook e honom nso so na wo de o comments afa ho e de aba de opese ubisa doctor efa ene ye topic aye discuss e wa ha say asthma yare bone asthma se ebi ntake oba na dwoda uhu se de esitie enti no yare a ewo ho na doctor ka say enya abonsam yare de na emom no ade a ewo ho etimi free ya wo mu ye nananum ye maame mu ye ya sefo no ye mogya mu na etimi abepie yen so ye mai esubi enti se unhu ne saa enu na doctor echechemu e de akire yen tosubiem so frama ye home bia bibia no oden enwisie bia no oden mframa ye home no yetimi enya frimu enti no ene doctor wa ha oboa yen na yetimi ehu saa de we asthma ne faribai ene ekwan ye befa so a prevent ana say ye betimi aboye ho ban afri mu a entimi eme hayen bebre enti ye to ayen komo ne so. Okay, Dr. Do can asthma be cured?
No. Because a chronic condition no. Usually chronic conditions no we manage it and cure no inti to me cure no completely but you bet me are controlling no so well that nya symptoms no
okay
crabbium
okay
so to me cure no but bet me are controlling no with the medications usually I'm more inhalers inti that's what I'll say to me cure no but bet me are controlling no very well that on tying your symptoms.
Okay, na said the yen timing cure na ye control no. Na say wo mu a betimi aba. Bibi trigger na betimi asan yi no aba. Yes,
see bibi trigger na betimi aba but even if bibi trigger no say indro na ide ama no fa ni year e be less likely say
e be how be
symptoms no. And on symptoms no cra enye severe e ma ye engine to ho. So the main thing is say you be control symptoms no yeah sana ontenya attacks
okay entimi eme attack will be brave
yes
okay tina me question back ye inhaler no do inhalers cure asthma
no
eno so entimi cure no
e control
no
and minimizes symptoms no so when your symptoms no dey da e be relieve or symptoms no two things relieve your symptoms no if when your symptoms no dey da and it also controls that it prevents you from getting the symptoms in future.
Oh, okay.
And two things, it relieves symptoms no and also prevents symptoms.
Yeah, no na inhaler no so no apart from say wo nro wo ho no enso behia say obenya inhaler no so
edro no ane
inhaler no
yes
eno no say inhaler dem hu say omo de share as omo de
so omano
no me no mamia
na
enti eni adra ye nom
they be
oh
guidelines no ndroni ni aye inhalers per the guidelines no you were very severe form of asthma you must some drugs but those ones are extreme forms of asthma. The friend Ruby biologics, but I think that one no.
Umom di anu yedin no na. Oh,
yes,
okay.
Umom di anu yedin. In prempini and drew that level.
Oh, sir.
And as Andrew no so no boy yedin biologics no. We barely. And in Crawford ye di omo to so crampo omuswa. And you be an obe here. Sir biologics no.
Oh, na you say asthma no yen shada ma ho aduro se kofa.
Yen shada me dra omo mene. But if
you
yes, that's the main stay medication.
Oh, okay. Wow. Wede minti da me kasi be ask me draw.
Debi.
Now some of them so mo believe herbs no. And no so ye adwuma.
Herba ne dear.
To
be frank with you, me sure say be adwuma. Because enu bi ne say unse na aka say what to say bi mo enu medro e bi wo hono ma omo no mundro be like tablets to prevent it
but nka better no ye inhaler
is the inhaler because it acts quickly unu medro a e be call system no man sana absorb alcohol blood ni man sana besin alcohol baby as say koye ejuma it might take an hour or two.
Oh, ntina o mind is simple na ma inhaler direct to lungs no airway no mo
na ma home na easy.
Wow. Oh, e me say na ene kam na mo nkoto ma asthma droma no. Wow. Okay. Na eno no does it have a side effect? Say we see wa fa ne dodo nti obenya ho side effect ebi wo ho sa.
Okay, see intro na wo inhaler mo no. Usually a combination into either steroids plus other drug.
Medicine.
Steroids no so trickle mo a ye to mo for say omo renzi omo enum. Enyansa niama white bi ebe to me develop you omo enum I a friend oral trash. Okay, see that's one side effect but usually people don't have much side effects with it. I just say ofane dodo overdose. No if you say be our heart airborne 10 and I say we develop a trauma so be on my bones and air so usually if you overdose it we are likely so being those symptoms so healing soon as one rains or math and so trash na me can one say no e be betumi aba ni papa no see the obeya say un healing we are say containing steroids oberens or math no appear that's all.
We okay.
We okay.
Wow. Ade ebi wo abrofo no obi.
Yes, abrofo wo.
Omo wo asthma.
Yes.
Sa.
Yes.
Na so mo kromo no nka dust bia nse de ni ho.
So because more of a genetic issue they can also have it. And from anu de no na be trigger the symptoms but the asthma no e wo hodeda. Then in Framano Behome, say ye cold, say smoke wound, say dust wound, and no never trigger symptoms, and only a friend attack.
Okay. It almost will be said, yeah, I wanna more recording, more taking records, and to say a day in penny for multi record or more issues, no, a dozen.
Like I say, pediatrics na emrana mene nkola ye adwuma no de na edoso. Yes, but penny for na sheda and doso as compared to nkola no. Yes. Mainly because symptoms no uni a etumi brass kakra nti. And then omunyi nso so a coordination of so home indro na so umia no ahome coordination is better. After like age 6 years, into omutume for mundro ni
okay.
So no so minimize symptoms.
Wow. Na say no an so be mo ani mothers no say ye kan kola de bebre de. Na say mothers na adwuma na parents na adwuma. Enti e wo se o mo hwe se nkola no. Be ma o munra mo de o ma atoso no. Be hwe ma nkola no. afa.
That's it.
Na say wonyi a ebe brase.
Likely.
Wow.
Yes.
Okay. Ewie de yesua de o. Asthma. Eya chese eya de a eba anajo. Honestly me mate. But obi a mehia no bia ne ba de o se eba anajo. Enti ya eno na em se ba anajo nti na nkrofo fi se eye spiritual sickness nana.
Yes, she say no ka hontina.
Nkrofo fi se spiritual sickness because eba anajo. Anajo na obebo wa. Anajo na oda hwa obehu se o chest o feel pain. Ti se ase aye dududu. Wow. Enye
anajo na likely say from anu so ye cold.
Ye cold.
And the sun so ye dry. And a room now oda no say stuff in it dusty oda ho for about 12 hours. So the symptoms are more likely.
And it's a spiritual sickness. Enya since me yare o. Yare ankasa.
Yes.
Enti no ebasa na yesi abotire na ya hwehwe doctor echikwan. Ewia yi send o messages bra. Enche ebe read the messages kakra yenya no. Na ye de bisa doctor amount. Eti de mintimi misa ma doctor mintimi misa ma wo no. Wo send the ba ye be read ama no na doctor akire wo. Nia opese wo bisa no akire mu akire wo. Enti ye number no eye 054 035 6306 054 035 6306 eno eye WhatsApp number no enti wo de fa hwa anase SMS ye be ready sa enso so ena ukọ Talkshow nso a wo de o comments fa hwa ye be ready ni nyina anase box TVGH ni nyina ye srew eni de mu share mayen se de da bia wo ye mayen no share na obi suso enhwe bi no nso fa ono comments emfamra bia na wo share ma no a ohia bibi ohia mo free doctor ho anase ohia se doctor explain bibi kire no doctor be kire mu a kire no na watimi enya ne ho entiase enti no share na efa o comments suso ebra na doctor wa haidie on kire yemu doctor that's air polluting ya say ya kan ho asem make ASTHMA worse.
Yes. Yes.
Na start okay.
So that's the one from me and smoke the one from.
The one from me. Ti say na omo amoye adwuma ti say industrial ones no.
Perfect. A man here worse.
A man here.
Said the American no omo me adwuma be a sawmill twa timber dust no. And as omo here grains we adwuma ti say wheat na soy almost sort it out no. That's na free no betumi a trigger na ama treatment no so iodine kakra na be ma symptoms no aye worse.
Okay.
Yes.
Okay. Enti no. Okay. Enti na ye be boy ho ban afri sa nema ne nyina ho. Doctor enti sa de no be den na yetimi a protect ye ho afri sa nema no.
Every
symptoms no ene sa air polluting no enema bi anu odin senti bi anu odin ebe ba be trigger sa nema no eno nso so mo de advice ma o meba mo nche no.
Yes, nti ye counseling even omo ni asthma no omo nema omo react to.
Oh, okay.
Nti for people with asthma no bibi a trigger or asthma no you be too for say stay away from it. Say bi onum kra one ne krama na ne cats edi agro bia a trigger ne asthma no.
Wow.
Bi on ma baby a ne backyard in full grass, flowers in shrine, pollen e honum. Nti from abo a ohome kon mo ebetumi a trigger asthma nti obia wo niama esese oye the train who free triggers ne ho based on baby a otse flower whether flowers or whether why too dusty whether almost shinema wo dan yechi ni ade no you have to stay away from some of these. That's one. The other thing is say self found draw regularly and on time so, to control symptoms no. Yes, those are the main things. Okay. So yeah.
Okay, nti eno nyina e boy ho ban free ho ebeboa na yetimi aboy ho ban efri sa yare ASTHMA yi ho. Pacho yenya messages ne kakra na mo de atoso amaye. Okay. Please, doctor, I am an asthmatic patient, and I like.
And like you are saying, in the night I can't breathe, and it's difficult for me to cough.
And no sir, no bed there, doctor.
See, I don't know anka. Phone so maybe san say indro ben or that so. Na ofani indro na.
Okay.
Because one funny indro no ana on for the right dose. Ana on to me and use inhaler. Yeah. Obenya these symptoms.
Okay.
So back clinic. Near train draw that's
so.
Near making adjustments.
Edemano. Okay.
Obikra on ma on day drobiaso. Maybe a help scran no use. You never know.
Okay.
The
doctor say you can say you should the near drew. But apart from inhaler,
any cure.
Na inhaler no more step by step ana.
You need different types.
Oh, okay.
You need different. I think the common one and microphone a friend of Ventolin and salbutamol inhaler. Yes, but per guidelines no now we are using it less and less often. Your other ones containing steroid plus salbutamol no. Dodona names different Sembicot and Wohono.
And also
yes, there are other drugs. It be a friend of seretide near the banini no ye.
It depends. Okay. Now so it depends the stage nipano ni asthma no say the city. And ma prescribe side drona mano. And I say obia timi fa o ska onto high o
David. It said your kind, your mild asthma, your moderate, and your severe asthma. Nini based on how often omunya symptoms. It's mild, no say omunya, let's say 2 symptoms, more than 2 symptoms in a week, or more than 2 night symptoms in a month, or more than or mobile clinic more than twice in a year. That's the mild asthma. Okay. For mild asthma, no, they can only use the inhaler as and when they have the symptoms.
Okay.
But said the American say Ventolin you use usually you use combination inhalers. One of them is Symbicort and containing steroid and salbutamol. It's a mild to me inhale as and when we have symptoms.
Okay.
No. So moderate to severe. As I said, you might have to take it daily.
Oh.
So every single day. So far to prevent it from coming.
Attacks. No.
Yes.
Oh.
To prevent the attacks. No, because to me you have more than 2 symptoms a week. Obey comfortable. Yes. To me nkwe juma ebe ma lifestyle crampo
asisa. Enti doctor sa asthma no ne attack no etimi ba just like that and I say ba ubehu symptoms bi kakra and te say obi say me na ya me ye de malaria na aba no sa na no so te say me hu say me sneeze bebre ni che say me asthma beba ana kwan be so na fa so a attack etimi yi ne ho edi at once.
See, most people no ehu say eba beba
ebi mu hu
okay your devices being so aye the more it's not very common.
Okay.
But then yeah the more they check it omu from egum they check how well they are breathing. Yes, it is a sort here. Who say treatment, either say it's not optimal, and I say some back to the hospital. Am I adjust your more injury?
Yeah, another. Please, doctor, please, what is the use of
asthma?
The asthma drain. Asthma drain. Okay.
A drobia monom think a containing salbutamol. They said in Americano. A drona is not the best. You have to use an inhaler because inhaler no I cut directly to lungs to say and it acts immediately or rapidly. Niama say no ma a call minimum then your body will have to absorb into your bloodstreams. It takes a long time for it to be a untume homeno. If I feel now benu medro beside might take 2 hours and our symptoms now relieved, which is not the best.
Okay.
So she should come to the clinic for us to show her what to do.
I say, please, can asthma kill?
So I'm controlling it. Yeah, it can be fatal. Most people don't have the severe forms, but they are severe and you to me to hospital all the way to ICU. Grandpa is here the tube. But those are very few people. The main thing is say as I said, asthma, udandro, so now we treat now control your symptoms. That's the best thing. Once we controlling the no, it's not going to get to that level.
Okay, doctor, that's it. Every idea we share here Talkshow enti say ya yegusu read messages no, your WhatsApp messages no nti usu betimi de ode aba beka ho nea opese obisa doctor no your number no egu screen anim a o de ba ye bebisa ana wo send the ba ye bebisa ye be read ama doctor na wachire mu e de achiro sa enso so na here Talkshow ye Facebook no e won so de comments fa e be ko ho ana se Bok TV GH ni nyina e be ko TikTok e won so ye be bo awura ho na e won so ya ko read messages a wo de fa ho e de aba no na etimi aboa enti yegusua e we questions nto enche ye be be phone lines no na wafre esim wankasa wafre na nia wo pese obisa doctor mentimi amisa no ama no wabisa no na doctor wa hey watimi ayiwa no asthma ye yare bone asthma e ya de a che se se uyo batan na wafa bi mu pen a na che se ne the doctor abetina ha aba studio ha oni ye ka ho asem no na che se ne doctor abo wasem super de ama fi se asthma de yare a ye hunhun a yare pa. Okay, Doctor Mpacho, ye try questions no questions basic to be aka ye baby saw. How does stress affect asthma?
Okay, see, one of the triggers of asthma, and so yeah, stress. Sometimes a bit more things like strong emotions. Say neniaji now I am very sad. A bit to me a trigger.
Wow.
Asthma. Yes. It's stress, strong emotions. A bit to me a trigger asthma symptoms. I mean, like just like every other person, be and it's all finding ways and means when you're too stressed up, we to me having enough rest at night. You also too much. The same too with people with asthma. So more try and manage your more time. Yes, I know many enough rest. They don't get overwhelmed and get stressed.
You can't stress. They say and can command your own stress. And penny stress, doctor. Make us say, be the whole day no. I beat you to the extent say, near obey and say obekwa down persona. I feel ubekakai. Na e honso so e na e distress e kwa akobei na e be den na yetimi a manage na say ya protect ye ho free sade no ukoda no e wose oda.
Yes, until usually mostly younger people you educate your more na you counsel them about screen time because pimping you be kwa akoda na cry your phone near scrolling through and e be so nature of work get even calls at night. Even say sometimes they call me at night. So you have to limit screen time and limit working at night. And the end of the day, internet man stress so as one major cause of symptom. It's not one of the major triggers of asthma. But then in penny for it's very likely when they are overburdened or overwhelmed and stressed up. It can trigger the asthma.
You manage your stress, no? You manage your stress. What brea na wakoda. I was say the phone to baby. I was say we be free wa dream.
Udum TV no.
Light even light cry we dum no.
Light no.
Na what me add the year. Eh, she said obviously asem na I asem doctor. Okay, and so how can a person manage asthma? How can we manage it? Apart from say ye fa ye drugs to say ye healer no ye activate no ye apart from that how can we manage it again?
So inhaler no yeah, like using drugs to control the asthma. We have other ways of controlling use to drugs. It been an church no. So cold air so be to me a trigger asthma no. Dust a war air mu and a smoke or air mu so be to me a trigger asthma. Until baby a air share there, it's better you stay away from there. Strong perfumes, sometimes even for the females, no cause saloon near there. It's difficult. Some of them is difficult to completely stay away from. To say organ, I'll say being stay away from dust completely. What you can do is that baby I wanna if a untarred road a quite fast would be find a way say ube limit the amount of dust enter room a be mount so one human wenya triggers no strong scent perfume so be try so about avoid it. Cold air during cold weather now will be a hoye new AC no anoya den pa you try and limit it. Smoke either say one kasa who smoking and I say air no smoke womb and dust womb and in Juma be or so it prones people say they na make so you Juma or sawmill and I say or sort out grain is very difficult say on home dust almost always dust no ube see if that's the only work out here because always you'll be exposed to it triggers no so ebeba.
Hey, asthma. Enti mpacho ya na mo de numbers na to so wa my why. Na doctor wa hey bi ana obi pese ofre no esim na obi sa doctor question. Eti okay, your numbers no egu screen no anymore. Ubetimi afre doctor afaso na nea echire wadwen anase nea wo pese ubisa doctor efa yare asthma ho no doctor wa ha say obeyi wa no ye number no 055 788 1871 055 788 1871 anase 059 179 2053 ye number ubetimi afre doctor na nea echire wadwen efa umpomuden ho efa asthma ho no ubisa doctor beyi wa no na onsusu wanya ho entiase anase wanya ho enchiremu na etimi aboa enti ye numbers no egu screen no enimu a ye twen se obefre na we nia opese ubisa doctor no we bisa no na etimi aboa. Okay, inti managing no doctor stress managing no anase asthma managing no obefa wundro
no stay away from triggers no
triggers ni bi emframa anoye den no cold weather no cold air
ebi o crampo enye weather ni per se ba room awo no AC na no ye den.
Okay, pacho obi abaso. Hello, good afternoon. Hello. Yeah, good afternoon.
Hi, madam.
Yeah, pacho udini baby a ufre free.
About Madam Vivian because she mankesim.
Yo, Madam Vivian, pacho doctor wa how tie o.
Me small girl ba ko bi won. Ba sisi ama ko fa no kwa be fie. O say ye o fa me 3 hour betro. E o mu ana aka no. Na eja nche ba sa na makote hela no na me de ama no na akofo. Ba mo fa ntu edro bi aso.
Okay. Doctor.
I think first no ben say obeko clinic normal confirm diagnosis no.
Normal confirm say our asthma.
Oh, okay.
Normal confirm.
Oh, okay. E dey say so dangerous and say so nya symptoms na nsomato inhaler no. Amano you won draw a prevent symptoms no. Inti so da so. E bi on ma severe na say every day bia na so use indro and say so train man nya symptoms na ansana we use indro na no betumi abo an said e oka no enche bia no kwa akotro papers nti ese odan dro so obefa sana onya triggers
no disturb no
man symptoms no
okay.
So why
yo Auntie Vivian enti no mo hwe ma no na yempe adra ebe boano symptoms no ebe control no
completely
nti isi amepesa ono obeko school yambo ochina obecho omobaye yi wo Monday nti obeko school ochina nti pesa ko oba na ma pe doctor nechi kwana na ko mo etrasi ama
ai doctor yo yati ye wi the doctor number be to screen no eso enti no ya na wafa why
Poche.
Okay. Hello. Good afternoon.
Good afternoon.
Pacho, udini baby a free.
So you frame free entry.
Yo, Pacho, doctor wa hayeti o.
Doctor me Pacho me Sunday message first message in a buy no.
Aye.
Somatic patient said in American.
Yeah.
Papa engage mame. Engage mame kura me name say me will be. My say I'm 53 years old. Na sister no a hame na jobia mintumi na say the work no. And na job na one ba. The one ba na me koko ayere time mintimi mo one.
Wow.
I was time mintimi bonam yi ahoro no. Ya mama no. Enhome. So na wo kana me issue me was symbolic wa ha. Symbolic wa ha. Eventually wa ha. Na me issue but still la doctor.
Entimi mwanu.
Amen.
Okay. This is the American no. A drop it Ventolin no say no. You're reducing the usage no for controlling and no so your symptoms na nka ofa.
Okay.
But so be here na do to say the man you can't ya. I say or go back to clinic. No sign drone. Emano. Emboano say enon kwa no befa. So far more like the combination.
Also mo di bibi kan ho de mano.
Yes.
Wow.
Yes, so they can give him just one inhaler. They're containing multiple drugs.
Okay.
Inhaler, preventing it from getting the symptoms. And when you have symptoms, so that be relieving the symptoms. No.
Okay. The doctor no say papa ide a ono tie ne kasa kra utim sa anadwo obre. Na baby okọ clinic na wokọ no na ye nkitu mu an wonkọ akese mu ana say onya specialist bi.
Me name say be a clinic no once no mo trade drone no be onko review dia.
Okay.
For sometimes no the otu a draw back so no match for review na say oba back. Nti okọ for review na ne say o church mu say the o church mu na say drone no.
Okay.
Amano.
Okay.
Ombese say.
Eno emfa ho ne baby obeko bia.
Emfa ho ne baby obeko bia.
Okay. Ene ejawe de bomode ne koy na say de esitie no am say undo no obonro be trade din ho
Ventolin and the main one or boy
okay
no M1
okay onko the advanced one okay your number no eda so e was screen anymore a obetimi afre nchemba doctor nchemba school hello good afternoon yeah mpacho udini baby a free
Ato semesi ya Africa so.
Okay, if you am pacho doctor wa ha otie o.
Pacho me go problem was mana mo mo ko mo na pese mi sakaka. Pacho ran wo be 20 years. Me ya de na mabre, me ko to ton ka ya asthma. Na mo ma me dro, me ko to asukaka na mo gusuma me dem you so inhaler ne sabita mo ndro ni ade ni bi. At since then, no, me take it bia na say. At me go hospital. Maybe someone send bia me nya emwaye bia na pese me say asthma me ko to fertility.
Doctor, me question we na nimu. Obisa say asthma no it me affect fertility no.
They be it me affect fertility because in drona obiafa no in pregnancy almost offer the same thing. Oh,
I know dey strong ma sa fertility no
they be in drone affected pregnancy and can farm pregnant women.
Okay.
pregnant women almost for the
same na okay
enye drone so ko hu na gynecologist na omuhu adekode pot into o take it or losing every time. No, I think it will help.
Okay, auntie we there doctor you are no simple why emfa wadro ne ho why na osi na osua na eye ne saa o
20 something sana omo diagnose
na etimi basa because osua no ye adwuma na ase wabre enu no ka symptoms ne ho
usually no a bit more description of symptoms near very
doctor enti de babaso no hello hello good afternoon. Yes. Yeah, Pacho, didn't baby out free.
Me Pacho, me the charity me kasafi ejeso.
Yo, Pacho doctor how old you?
Yo, me dance. Me Pacho me person me bisa doctor say symptoms no. Udi a great piania, it's me mau it's me trigger and I finish no. Me person me bisa the insia ye binom ye nyini me obe 32 years ansa menya attack no nti de ntia etumi bane say bia say yare ne wo hwa ye hu
ntem
aha ansa aba no e na mostly no so me de ne say eba anajo
doctor.
Okay,
Pacho doctor you are
no
yes. It's very likely that she's allergic to that food, no?
Well, so
that's all. Okay, that's one. Number two, no. For people with mild asthma, no. Sometimes they will grow till like teenage or even 20s or 30s and suddenly are diagnosed because yes. Ebimusu the answer is specific to aduane odi and andra or fatty said them kind of aspirin induced asthma. If they don't come into contact with that thing, onya symptoms no.
Okay.
One of those few ones now. I just we dear could be a better Ghana. Ebim so the asthma at all. If they've not diagnosed there in a clinic, it might be something else. It might be that in Yanibi or Honma or and she has to stop it. That's all.
Oh, okay. No, see attack no 30s. Need the dani who di 30s. And also timi basa.
Timi basa.
It
to me see no. So it could be asthma or it could be something more or less like an allergy. Or reactive to it when this are in
because me kai said there's a lady be a was in a bar na or go through all those things no munim say ne blood group no. There is a food particular food be a odi. According to the lab okoye no enti ema umuhu se aduane na ode ma abofra no ena ema no react that those things nti ojaye no ema biem.
Yes, it's not specifically in the blood group per se, but we have blood tests there. They checking your mouth to react to.
Okay.
Yeah, sure said that test on okoye. You find say be a udi, if you don't react, if you a shellfish react to it, you just stop it. And a peanuts react to it.
Also ujai. Tina is a lady charity no. Onko
clinic near sure. Say asthma na say she's just reacting to some things.
Because need the so anaju na eba.
Yes. Yes, so it could also be asthma or it could be an allergy. It say occur near hwehwem near sure what exactly are.
Okay.
Cause.
Okay. Yo. Nyame esha. Okay, nti ye na besni da so a egu screen anim a onso betimi afre doctor na onso de akire wadwen mama ni de bia ebetimi ay allergy bia ebetimi ay asthma.
Yes.
Enema no enipa ne go through onema bebre mu a bia na nye de wo de wadwen ebu no sa na eti bia na ebibi foforo enti ne nyina no they say na ye nya doctor wa ha se ya ye frɛ no a wo explain wo case no a obekire mu akire wo say wo de bia sanko ne kwa bia ko hu doctor no koye test foforo na ye hu ade cropotia how eti numbers no wo screen anim a betimi afrɛ na onso ode wadwenkire ede afaso ede aba na say wabisa o question a opese obisa doctor ye number no 0591792055 059 179 2053 and I say 055 788 1871. Nina Ufra. Hello, good afternoon. Hello. Hello. Okay, Pacho try next time brana we Hello.
Hello, ma'am.
Yes. Good afternoon.
Good afternoon. Necessary.
Me Pacho nyame adum ne ye twen. Pacho udi ni baby a wo free.
The family sunsun koma for kwame bi isisi anyasu nuano.
Yo, eja Pacho ye tie o. Uti udi ni ye say sunsun mu koma for. Yo, papa ye tie o.
Anyasu nuano.
Yo. Doctor wa hanti o tie o.
Pese mi bisa se. Asna no ayemu ana se eyeje na mane basa.
Okay. Doctor.
He said the American no, it's more of genetic. Okay, see. So be mommy will be an obi papa will be an anemia will be likely so on so be nti more and yet bibi to say infection.
Okay.
Be and yes and
infection enye bacteria bia na enye virus bia
virus ne bacteria na betumi a trigger symptoms of asthma, but enye the cause of the asthma. Enye so nya viral infection tina waba benya asthma no. It means he or she already had the asthma. Okay. But then viral infection to say cold no and a trigger symptoms need to know to me and home.
Oh.
The asthma no there's more of genetic and infection.
Okay.
Yes, and infection.
Okay. So move from Pacho what the doctor can?
Pacho Martina me bisa say let's say e wo mojemu ana.
Sa pepepe. Sa na doctor can.
Yes.
Enti eni aduro.
Oh, I won't draw. You won't ready controlling no, but you find cure asthma no completely. So you won't be able to media controlling you so well. Say unya symptoms no cry.
But I have a big crowd now. Can I? When I am the not say, that's not so. This is what that last year. I know it's doing.
Light, I know it's she.
Debut. What's a light, Debbie?
O see, also more na light I know them.
Debbie.
O see said the ebeya uko ye juma na wa brebebre na o meda kete so nsa anwenwen nti wo bedundum light we dum phone so ne ade.
Mpatwale mati.
Aha. Enkase na light. Okay. Yo. Yeah, that's so free. Inti your numbers na gusu egu screen anymore abetimi afre ye nyam free ha inti ye twen wa won so wo hwe yen na opese ofre na obisa doctor dia opese ubisa no nti ye number no gusu a egu screen no anim obetimi afre doctor na watimi ebisa no wasem a won so ode ebaye doctor nti eye de nti na saade no anadwonko ana etimi eba. Because who say beginning who can say especially obi some of them na anajo be parents no madam mothers no anajo no amane ban so de chete me ban ntimi nhome they see mami of free dance so me on so kan we say ne de ne ta ba anajo e de nti na ya na timi anajo na saade no etimi ba.
So usually anajo na ya whether no a cold and I'm from and so cold and dry, which is one of the triggers of asthma. No, also at night, no, what our bedroom, if room no air stuffy and are dusty, very likely say trigger no, ebema asthma symptoms no aba.
Okay, Minty, hello, good afternoon.
Afternoon, madam.
Pacho, udini baby are free.
Kaseti ejosu me di entia.
Yo mpacho yetio ya no aben. What me e de way na ko anu kakra ne ate wonka. Doctor etio.
Because me say me this me will be ba me call doctor ma enkai. Ba me ready here amount for me na. Because ba me ye ade na boro so na se me ye fiade ye kura. Na me ho me no so me go me ye kada fuma ye ko so me ye.
Wow.
Na wudie me ye kwa na me ho me chi
Doctor, also on call hospital. Madam, so on call hospital, my doctor and can't na eba sa we den na utimi sa eba normal.
Eba sa na de me ye bia me jai na me do fine. Na me ye dia. But that no me na tum na kope.
Na fe wasa wa home na bakama. Doctor, no is it asthma? Asthma.
Okay. Na pacho we di fie say na or bibita hypertension and diabetes na.
Mama, on pacho doctor bisa a question. Also who won fie be say?
You 47 years.
47. Okay. And na uni yare bia ti say hypertension na say diabetes bia.
Oh, I know the
Nyame adom. Okay. Also oni bi doctor.
Okay, that's good. I think say the best thing is say obeko nearby clinic na omo confirm say asthma na say asthma because say asthma nkwa na ebetumi ama home no enye nti okoni say confirm ade dey na to the right medications and so
okay
but for now na you confirm and you ntumi nya sure say asthma okay you won near test ya dey confirm ti oba ni say
na say dey mami okay won fa duro nti say no say e basa odundum ne fine ne ade no no a o say
anta chokasa
ana say wo no e basa wa udundum fine na wa wasa ba normal
do fine na me ge meye no jaya na me home na me bla bo se asabi and
wow.
See, mild forms of asthma, a bit me I say, na make less than 2 symptoms in a week, less than 2 symptoms at night in a month, less than 2 clinic visits in a year. It's likely a mild asthma. The other thing is say obi on ma so me adwumaden a na no exercise induced asthma no. So mo je o ma home a symptoms no e but ni no is a so back clinic.
Okay.
Yeah, confirm say asthma mpo a na e bibi fofra. Yes.
Okay, yo yanti ya na wako doctor na Dr. Hwama. Hello, good afternoon. Hello.
Hello, good afternoon.
Good afternoon. Pacho udini baby a free.
Me pacho Mr. Boatin my son baby.
Yo.
Me pacho na me pese me busa doctor. Mwana.
Pacho yanti wonkan ye.
Pese meti ma da fan mwana.
Aha, okay. Doctor.
So.
I mean
So asthma.
No abre.
Now, Patroma diagnose you with asthma. Oma diagnose you with asthma now.
First, me
Why need to choose?
Mr. Boateng. Me Pacho. U asthma no edi say.
Kakra atem
15 years. Until call doctor na doctor diagnose with asthma. Oh, okay.
Okay. Oh, that's good. I mean, like so found draw you say a control your symptoms here. Yes. You can sleep under the fan. Say get too cold say and trigger symptoms now. You can actually sleep under the fan. But as I say, only get too cold or dry, and I and so trigger symptoms and so that's the main catch here. And so making sure say offer undro a controlling ye and our other fan as and trigger symptoms. If all these things are met, you can sleep under the fan.
And I'm back today.
Mr. Bati o line no emu kati enti enti wonkan ye. Oh, enti doctor papa yi ni die ya nanka onja fan aside.
Oh, so that fan asness and trigger. So mainly no sodium your stages of asthma. We have the mild one, moderate symptoms. We can actually let him sleep under the fan. A severe one is say what that fan acid that cramp me agena to ICU. Of course, and say be on day droswa, we first of all put him on medications. If still well controlled on medications, but that fancy about, we can tell him to use another option.
Okay, yenti de waba so hello. Hello?
Hello.
Yeah, hello. Good afternoon. Hello? Oh.
Hello.
Yeah, good afternoon. Pacho, udini baby are free.
Me dey Paul we kaza free nkaka.
Okay, Paul. You nkaka fine.
Western region Amanfi.
Oh, okay. Pacho, doctor wa how o
Pacho, person busa say inhalers na wo me different type ana.
Pacho I.
Okay. Then tina me busa say me wife will be into me to inhaler no man but say symptoms na say you see sir but still obetima use na pa na afternoon time e better attack them. Even if you see more than 3 times a day, still the distance not going.
And Pacho, type Beno Yusu.
I biocode something. I didn't just look at the name very well. It's biocode something there.
Okay.
And we low standard nibia.
Me sure say ABR Symbicot na. Or pronounce it.
Yeah, Symbicot, yeah.
Symbicot. Okay.
Yeah.
And Pacho, yeah. Send SSO fano. I mean, or call clinic the man, send catch any song fano.
Now I'm not describing as a bar one uses, and I'm okay.
It's a ban.
Like it's experience sometimes now I use it.
A ban offer.
So some of these instructions, no, here.
And so here.
Sometimes I saw fun every single day. So training say bands I'll use they say a juma or the your mouth. So it's more of moderate to severe asthma. And no dear now say be crowd fun twice in the morning, twice in the evening, every single day. So symptoms are well controlled. Maybe yeah, they about 1 in the morning, 1 in the evening.
Because me I say in here no obi atimi ra pharmacist no be our koto de Oyebiana or Anna no
dear containing salbutamol and containing steroids. No, I think most of the pharmacies might do that, but they're containing steroids. No, it's ideal sell or prescription.
Okay,
and as over clinic near prescribe amount near trail said here. Obefano. Ni ama review dates. Tell no be catch and say fan ronosan unya symptoms. How many times? Ni a share no so dey. I make changes and as you maintaining on that dosage. Tene dey no say e bansa offer. No. It means no emboa no.
Na say on san ko doctor no.
Like he say so offer every day.
Every day. Na doctor no emma no prescription ni yie.
Yes.
Dosage no yie.
Dosage ni.
Di say onfa na nopa, no onfa na nwumre. E mai kra onfa.
Mai kra onfa. And no be prevent future symptoms.
Symptoms no. Okay, yentie de waba so hello.
Hello.
Yeah, good afternoon. Mpacho udini baby a free. You auntie be Mpacho doctor wa how tie o.
Yada na asiba ni ni. Pa madam ni na. Ti ho me. Asa no ni ko. Asa ni class.
Sakura ni kasan. Auntie be Mpacho. Auntie Becky.
Amen. Bedu.
Auntie Bedu, okay. Auntie Bedu Mpacho. To boas na ene yen kasa doctor wa ha. Ne the doctor abreu free. Enti wo sisen.
Wo
pressure.
Na Yada na asili ni. Ida ni le ko si ni ni wani.
Ne ho me ne ko.
Sasa ni sayo sayo. Ni tadi sakra ni ko pa pa de pa.
Ayedin.
Ina mo ko da sada kan ba gan se. Na ma na ye.
O se wo de na ayemre.
Akoma. Akoma ye. Mama na je de
Intimin enko said they all say ko. Your doctor Pacho nyabote doctor how you are why?
From what she is saying, they likely say asthma.
Asthma.
More of heart failure.
Heart failure.
Yeah, because
okay.
when your pressure check, maybe your heart no, iron large. The no symptoms no are very similar.
Okay.
We are the kakra no
one bread. Oda wunti minna.
Keke crowd jari we are na o go ahome to say the we
bread.
Nti no na heart failure anti so okono mo modify. Ni ndro no man ndro bebre hon ma.
Omodaso.
And yet the same as asthma.
Oh, okay.
Different.
Yeah. Auntie bedum pacha wutie doctor. O say say wo be call doctor. Mu wonu bebre wo ho. Enti they said they wo hu no eti say asthma but bia bibi foforo. Enti ko na mo nsisa wonro no ma no mo fa wonto aduro ne so. Ebeboa. Okay. Yo. Yeah, some doctor. And he say no. Yeah, number no go screen anymore obetimi afre. Now so there you try 1 or 2 callers. Hello, good afternoon.
Hello.
Yeah, hello.
Hello.
Yeah, mpacho udini baby a free.
What from Mami Grace?
Mami Grace.
What from Mami Grace? Because it's trouble.
Yo, mama yeti o mame.
What's on Mediana? Mediana, I am in the mean auntie. And take a crabby and I'm a homie.
Oh,
now my issue bring me up and so send me for. Can I say, woman? My master and baby, he sent me issue every me. The third time the call says, your mamma dry. Not my best here, say a BP. And so the last one I'm the call about no name BP. I said, Mr. Doctor said, she said, we said, answer share me, say, you're very dear beyond him.
it's ensure won't quite lab be answer.
Mr. Doctor, Doctor, he needs me to make baby, with you.
Doctor, why the la doctor dey say mami mu eneja?
He know na home na na say me say e ho na say ye.
I home na.
Auntie Grace, o home no na ye o sa.
What time?
Oh.
From the organ or say or high blood pressure. And I think so or ye bibi kakra no abre.
No abre. Yeah.
We to me I say na kuma no na ayemre kakra.
Don so de na ayemre sa.
Yes. Nti say okọ.
Doctor, that we no be church say we no why no.
Heart failure.
I asemo. Ye be no
so.
Wadaroma.
See, and also so yeah, investigations totally different from asthma.
Asthma.
As I say, oh yeah. Or see, or call one clinic be bomunya investigation.
Oh, so mo infa fidie bi ansisi ne so.
I would advise that yeah.
Onko baby fufuro.
Na omo.
Ne kwanti.
Yes.
No, ntna o mane nye late.
Ntna ho mane nye late.
Okay. Okay. Auntie Grace, enti we there. Yes, so baby, I want doctor na wo kono say bia omunya anima omo ho so wo ho a na wakọ baby fufuro na eja yetimi ahwe ama ye last caller. Hello. Good afternoon. Pacho udi ni baby a wo free. Pacho ma oni so kakra o ka se free. Okay, techimai udi the same. Mary, okay. Doctor wa how tie o.
Because it's other stuff and we have not taken. Now, I'm not making a little bit power.
The minimum.
I was yeah. Woman, yeah, pass there more than 3 people. You say, yeah, but still, you need to see that.
Yeah, Samo. Doctor, what's your name?
Yeah,
Mary, okay.
Most or say on homia. Nedi and about homia, or to send minimum. Said them kind viral infections a bit to me a trigger and Tibiana when you sore throats and a sans or trigger and asthma. No, and no sans to say Nindro no fano and buano. number one, udrone mboawa esa call back to clinic no normal sign drone say omo adjusted dosage no.
Okay.
Mprempi no from most of the callers I at your monka no. Omo fine drone no asen when na omenya symptoms. Sometimes no enye asen when. Sometimes so funny every single and sometimes so a drone type no. Ventolin no nye the one as so be a daso. Ebi mo some other combination inhalers. So nti esa oba ne hwe say the two combination inhaler. And how often obefa inhaler
no so important.
Yes.
Oh, okay. Yeah, ready. Adibi wa abaka say obakufo fie ne wo. Enso enye eni wa bakufo fie o. Enti no. Yo, yeah that's it. Doctor na me question back one person bisa ne say ye hayati heat him. Ye wo heat.
Yes.
Ye ntisa abrofo no mo de mo tu weather no. Mo wo cold ni na sefo no. Ye de always heat cry ye cold no cry to say obi asoja. Na dentina those things no still no ye facing it say eye ekoye bibi to say ensesa wotna cold place anasa woda baby ho nyu bebre
nti enye the cold itself per se inframano a ohume cold no is the main thing. Okay, unse sisi na higher cold but then inframano enkoye mu direct sa baby mo no man inframano ano ye gin and e cold and e very dry to say during seasons like Hamatan. The one from near dry, asthmatics enya a lot of attacks during that period.
Say Hamatan e rem see a woman. January, December, January, February. Not just say grade. I say yes, sakakra.
This year and sheda
anya yeah.
Is the dryness no. So cold and dry, not just cold nipe because of course say riemu yeshia obi happen from kakra ni ade. And there are other triggers and so enye
inflammation oh nnuane ayedi allergy no
strong scent, strong perfume, smoke, dust.
Okay ninyina na wo say yehwe
say yehwe na indro so ese use so into cold air ni say obi ofa ni indro ye no e be realize say I just say akọ extreme cold and sana we nya symptoms but on fe indro na even the slightest cold dry air bia no betumi a trigger symptom no.
Oh
yes.
Okay we dey na dey yesu ade Dr. Cheche ya de enti ye de number no ya mumfa doctor number no so ntu oman yen na so obi pese o frɛ no na wa frɛ no na wa kyerɛ no ba bi owo na se na se mo pese one no eka no na one no aka enti we de aha ene ye de wo esi na ya ma obre bebre a wonso betimi afrɛ ye mu bebre timi frɛ yemu bebre timi bisa ye questions yemu bebre so send ye messages e de e buy nti ha ene ndo ebesi doctor ntimpacho advice a odi be ma omu a e wo sa condition no no break akrai fama wo mo mai.
Okay, nti first of all all sa symptoms for ya me boboy ya cough, chest tightness, wheezing no and difficulty breathing na esa oba clinic ni ehwe e confirm say or asthma na say unibia e confirm ya you won dry e de obeto so e betumi a control asthma no said ye unya no frequent unya symptoms no frequently and unya symptom no so e betumi relieve or symptoms. That's what I'll tell people. Omo ba ye be mo mundro ye be counsel omo nti bibia be fine.
Okay doctor na ye ni ya hwefo callers na e frɛ no majority no eye omu a omunro hu nsem obi a ne dro no entimi nkiki no.
Yes.
Obi a ne dro no wifi still a hu improvement bia enso wo kasa mu no ya de e wo say hu o dosage no na hu correct medicine no a e wo say ade ne timi brass.
Yes.
And so still some of them no omu hu ne sa Omo be ne den.
See, one major problem in clinic, not only with asthma but with other conditions here, medication compliance. Say adrona edema no offer, and your mouth review so oba here. In pain, you will be to 1 dose so you're training in 2 weeks, in 2 months. That's one. And I say most people also go and buy it at the drugstore. The first one. Because in drone you know stepwise you found to the highest dose from scratch and drone also technique even inhaler no ebi won ho omonim use e da obeba okay pacho use na menhwe no don so yes something totally different.
Okay.
And all these will help with the control. Tinye de bia na ye dose scramble sometimes they will see you soon no kra in you soon ye TSC e kire no ye.
Okay.
Na
Okay. Yedasi papa yedasi papa eja wadaroma ne omodembo nyame aduma obo homodin yesre wa wo homa ye na da bia nsusu no ye hia wa yetimi afrew me de ma no fa ho kakra enti ya na ede dwumadie ni nyina esi ene nyame enhira obi bia wo ne ye edi dwumadie wa wo frɛ ye wa o send you messages wa o hwe bi keke krampo no nyame enhira nyame enhira doctor papa enti doctor nyame ya adoma another day ebeba de na chese another topic na ye de ebeba enti ye show bo ye talk show ye show boss ya hwefo boss ye mpomuden ho hia yen enti no e wo said da bia Saturday bia wo follow your program ayeye na etimi eboa na wa support yen so bibia mu wo support ya ebeboa papa enti ye be sorry na mum ye fa kwanya we so na ochina service no ya introduce the amount say ochina nyame ya adoma 7 na service no eye communion service enti brebi na ubeye nhira bebre na onyankopon ebeti nanim ama ye papa ne bedi anim e wo service no